Hi, my name is Gerritt Breum, and in this video we're going to teach you how to do CPR. You might ask, why is CPR important? Well, because heart disease in the United States is on a rise, and 88% of people who suffer from cardiac arrest outside of the hospital and sadly end up passing away after their incident. But by knowing CPR, you can increase the chances of their survival. Within 2 minutes of the person going into cardiac arrest, if CPR is given, it doubles their chance of survival. And in 6 minutes, the brain death will occur to the patient. And by doing CPR, it will pump blood through their body into their brain and oxygen into their brain as well, and then circulating their heart, and then putting oxygen into their important organs. And cardiac arrest can happen at home. 4 out of 5 of cardiac arrests happen at home to a loved one, and they don't show signs of and symptoms of going into cardiac arrest. And 3% of people who know CPR, only 3% of people of the United States know CPR, which is not a lot. And with it being 6 minutes of the patient being brain dead, the average time of EMS response in Utah County is 8 minutes and 30 seconds to a scene. And in rural areas of Utah, it is 10 minutes and 50 seconds. So by those numbers, the patient doesn't have a good chance of survival. But if there's someone on scene that knows CPR, their chances of survival will double.
Hi, my name is Hallie Larson. I'm an EMT here at MTEC, and I'm also CPR certified. And today we're going to talk about the steps of CPR. So the first step is BSI or PPE. You want to stay safe from diseases and substances, so gloves will work. The second step is scene safety. Your safety is the most important, and we don't want another patient on the scene because we don't know how they were in cardiac arrest. Next step is to check if they're responsive or not. So just say, hey, are you okay? If there's no response, then get someone and tell them to call 911 and get an AED. So call 911 and get an AED. Next step is you're going to check if there's breathing and a pulse. You're going to look, listen, and feel. You're going to look for chest rise and fall, listen for breaths, and hear for breaths. Okay, I feel no pulse and breathing, so then we'll begin chest compressions. So we're going to do 30 chest compressions. 1, 2, 3, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then you're going to do 2 ventilations. And you're going to do a head tilt chin lift to open their airway, which looks like this. And make sure you have a good seal on the mask so the ventilations can go in, and look for chest rise and fall. And you'll continue that cycle until the AED is given.
So I'm going to show you how to operate an AED. So first you're going to turn it on, and it'll give you some commands, but I'll probably go over it. So second, if they're wearing a shirt, open up the chest, make sure there's no liquid on it and there's no medication pouches. If there is, remove them. And then if they're wet, wipe them down with a towel, and then apply the pads. So you'll have these 2 pads. Both of them will have stickers of where they'll go. So this one's saying on the upper right side. So you'll put it right here. It has a little bit of an adhesive on it. So you'll take off the plastic on it, stick it right here on the chest. And the second one's down on the left side, right down here. So you'll stick the pads onto it. Make sure they're stuck. and then you'll plug this into the AED.
Analyzing heart rhythm.
And then you'll say stand clear because it is analyzing the heart rhythm, deciding if it needs to shock or no shock. If it says no shock, begin chest compressions again. If it says shock, it will say shock advised. You'll have everyone stand clear while it's charging. So it'll stand clear, so you'll have everyone move, so stand clear. Then it'll say deliver shock, so you'll say, okay, stand clear, make sure no one is touching him, and then press shock.
Shock delivered.
Okay, and then you'll begin chest compressions again for 2 minutes, which is about 5 cycles. And then you'll keep doing this process until EMS arrives or there is a change in the patient's condition.
And then you continue until EMS and 911 show up.
Okay, so now we're going to talk about infant CPR. Infant CPR is very similar to adult CPR. And to start off, always make sure you got your gloves, your BSI, and make sure the scene is safe. So in this situation, we've got our BSI, scene is safe. And how to check for reactions from a baby to make sure, check responsiveness. You can flick the bottom of their foot, and that should normally get a reaction if they are conscious. Hey baby, are you awake? And if we don't get any response, check for a pulse. You can check, it's called the brachial artery. It's right on the underside of the arm. So you check for a brachial pulse, look, listen, and feel for breathing and a pulse. I don't find any breathing or pulse. And then we will start directly into chest compressions. There are 2 ways you can do chest compressions on a baby. You can take your 2 fingers and do CPR this way, or you can go around their chest and use your thumbs. Either way works. And for one rescuer, we're gonna do 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. And then we deliver 2 breaths, but in this situation, I don't have a way to give breaths. So we would just continue doing chest compressions. And again, if you do have a way to deliver breaths, you do a head tilt, chin lift, and open their airway that way. And then you continue doing CPR until EMS arrives. Okay, so BSI, scene is safe. Hey baby, can you hear me? Are you awake? Not responsive, and check for breathing and pulse. I don't know if I had breathing or pulse. Hey, you go get an AED, call 911. 1, 2, 3, 4, 5,
Apply pads. Plug in connector.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10,
Analyzing heart
11,
rhythm.
12.
Okay, stay clear of the patient.
Do not touch the patient. Shock advised.
Continue.
1, 2, 3, 4,
Charging.
6, 7, 8, 9.
Stay clear of
Okay,
patient.
stay clear.
Deliver shock now. Press
Okay.
the orange button.
Shock delivered.
1,
Delivered.
2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15. One, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 9, 10, 11, 12, 13, 14, 15. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Then you continue until 911 arrives or the baby becomes conscious.
Okay, so the difference between the adult pads, pediatric pads are obviously the size. They work the exact same, and how to use the AED, the exact same thing. You'll just use the pediatric ones. On these ones, it has, instead of going on the chest and on the side, it will be telling you to go one on the chest and then one on their back, like that. And then if these aren't available for use, you can use the adult ones. It's just the same. You put them here on their chest and then one on their back. Don't ever cut these or they will not work anymore.
Remember that CPR, when it is started 2 minutes after the patient has gone into cardiac arrest, it increases that patient's chances of survival, it doubles it. And then if you're unable to provide ventilations or breathing for the patient, remember, continue chest compressions. They can still save a person's life. And remember, for adult CPR, it is 30 compressions to 2 breaths. And for infant CPR, it's also 30 compressions for 2 breaths with with 1 rescuer. With 2 rescuers for an infant, it is 15 compressions to 2 breaths. And remember, CPR should be, the chest compressions should be delivered at 1/3, compress the patient's chest 1/3 of the way. And